Hi, welcome to our video presenting the Memory Disorder Clinic Outpatient Neuropsychology Rotation. I'm Jessica Vassallo. I'm one of the outpatient neuropsychologists here at the Tampa VA. I also function as our training director for all of our psychology training programs. I want to also introduce my co-supervisor, Dr. Erin Bailey.
Hi, I'm Dr. Erin Bailey, and as just mentioned, I do co-supervise the outpatient neuropsychology rotation for both interns and our postdoctoral residents. And the goal for this video is to provide you with an overview of the rotation for our internship and address some common questions that we typically get asked by applicants. So this is a 3-month rotation, and this is required for both of our neuropsychology specialty track interns. And so those interns typically take the rotation in the first 6 months of their internship. However, for our non-neuro interns, we welcome you all as well to take the rotation if you're interested in assessment in the latter half of the year. And we strive to meet you where you're at, either to advance your assessment skills or to make you an effective consumer of cognitive evaluations, including how to implement recommendations effectively. So Jess, maybe you can provide an overview of just the goals of our clinic.
Absolutely. We're a general outpatient clinic, but we also function as an early detection clinic. That means that patients come with some of the earliest of memory complaints, all the way to those progressing into the moderate stages of dementia. We see all types of neurodegenerative disorders. So on this rotation, you will see patients with suspect Alzheimer's disease, vascular dementia from a variety of etiologies, including stroke. You might also see Lewy body dementia, Parkinson's disease, with or without cognitive impairment. We also typically see a handful of the rarer neurodegenerative disorders, such as some of the PD+. So you may see a PSP, a CBD, maybe an MSA, as well as maybe an FTD, like a PPA or a behavioral variant FTD. Our clinic sees people across the lifespan who are experiencing cognitive change, and oftentimes we're the first providers that they've spoken to about their concerns. Erin, how is patient diversity represented in this training experience?
Well, just like you mentioned, we do see a wide variety of diagnoses, and I believe that's because our consults come from all over the hospital. So likely referral sources include primary care, neurology, audiology, even consults from our own service, like the Women's Center. Because we're a VA, we typically see male patients, but that doesn't necessarily mean always. And because our clinic does have a strong foundation in assessing and diagnosing neurodegenerative disease, a lot of our patients are geriatric, usually between the ages of 60, but all the way up through patients in their 90s. We also have a wide variety of ethnicities, family backgrounds, education, and literacy levels. And because we live in Florida, we have some patients who live here part of the year and part of the year in other places all around the United States and Canada. So our patients reflect a diverse range of regional and geographical areas as well. And maybe you can speak a little bit more about the diversity of clinical experiences.
Absolutely. So the patients that you see will likely have experienced some cognitive change. We do have a lot of patients who come to us with very early memory complaints, and we have a screening process in our clinic so that we can look at those, we can work with those folks who may be experiencing normal aging that is distressing. Now, while that's not technically part of our rotation, you will learn a lot about that screening process while you're here. In addition, patients really present with a variety of diagnostic possibilities. So this includes dementia evaluations, post-stroke, epilepsy, as well as pre- and post-surgical intervention. While we do see patients who have experienced TBI, this is likely in the context of a remote injury and probably not the primary cause for the referral, as we have other clinics that tend to focus on acute or subacute recovery from TBI. This is a high volume clinic, which means that in addition to a variety of clinical experiences, we also want to be able to balance that with workload expectations. So Erin, what are the expectations of an intern on this rotation?
That is a great question and one that we are asked frequently. So interns are responsible for conducting 3 full evaluations per week. And typically we use a tiered supervision model with the postdoc who will also be rotating with us on the rotation. Our full evaluations are targeted. And so they're typically shorter than maybe evaluations that folks do in the private sector. Um, they include an interview, testing, and feedback, all done within about a 4-hour span, with the second half of the day more devoted to report writing. Our report writing is focused on creating consumable reports that appeal to a wide variety of readers and referral sources. Reports are typically edited and posted in the patient's chart within about a week's time. In addition to clinical responsibilities, interns on this rotation are also expected to attend 2 one-hour didactics on Wednesday afternoons. The first hour is dedicated to reviewing functional neuroanatomy and the process approach to testing. In this seminar, interns will learn how to interpret test scores within the larger context of a patient's presentation. In the second hour, specific disorders are reviewed with an emphasis on common symptom presentation, differential diagnosis, treatment, and prognosis. And the goals of these seminars are to enhance skills necessary for eventual board certification in neuropsychology. Just speaking of skills, can you describe some of the common tests that we administer in this clinic?
Absolutely. We utilize a fixed flexible battery approach with a core of tests across all cognitive domains that are targeted primarily to the general referral question and the age of the patient. You will modify and expand that depending on patient demographics and the specifics of the patient's complaints. Our goal is to have you learn and use a set of measures across different patients so that you develop an internal norm set that assists you in your conceptualization. Speaking of conceptualization, our goals are to focus on integration of multiple sources of data, including integrating the test data with behavioral data, using a process approach to arriving at conclusions. We also strive to discuss cultural sensitivity and humility, especially around how our measures may or may not represent some patients. This may mean finding the most appropriate norms or through an alternative selection of tests. Erin, how would you describe our supervision style?
Well, supervision is provided at every stage of the clinical interaction. And I think our supervision styles are pretty consistent in that we both use a developmental approach. So this means that we meet trainees where they're at and emphasize critical thinking at each level of a trainee's skill set. For those trainees with more advanced skills in neuropsychology, we want to expose you to a wide variety of diagnoses so that you develop strong clinical acumen in atypical cases, such as patients who are very medically complex or those with more severe symptoms. For those who are not pursuing neuropsychology as a career, we want to provide you with a strong foundation in assessment so that you can understand the data you obtain through testing and make appropriate referrals. All interns on this rotation work with a variety of other disciplines in providing recommendations, and all trainees provide therapeutic feedback to patients and their family members. We believe that these are transferable skills in and outside of a neuropsychology specialty. So we've been over a lot. Jess, is there any other information we may have missed?
There's a couple things that often get asked. The one that I think about is research opportunities. While there's no active projects going on right now within our particular rotation, for those who have defended their dissertation, there may be opportunities to join a postdoc on a project within the outpatient neuropsychology clinic research group. The other thing I want to mention is that we really like to work in a fun and collegial environment. That means we take a team approach to patient care. We have case conferences every morning that patients are scheduled to hone your case presentation skills. And we'll also provide mentorship for professional development as interns move on to the next phase of their careers. Of course, you may have many more questions and we'll be happy to answer them during your interview day.
Thanks for watching.